and hopefully at a time of year where we can do something about that. We focus on problem solving and utilization. So we're your helpline. You call up and we will help you with a bill you don't understand, a provider you can't find. We are aiming to provide the kind of concierge healthcare assistance that the very wealthy have in this country. And why not? That's what these people need. We know that because we've offered it and they've taken us up on it over and over and over again. And we get people through the roadblocks to see doctors, through the roadblocks to get subsidized policies they otherwise weren't getting, and on and on and on. And so that's healthcare. The other thing we're starting to do is some affirmative work in that area, which means we'll call you up, Harriet, and we'll say, listen, we've managed to arrange for free dental services for exonerees in your area of the country through a special project that we've coordinated with a providing partner. Would you like to participate in that? Can we help you do that? And if you say yes, then we're thrilled to do that. And you would become one of what has already been 137 exonerees across 22 states that have gotten nearly $500,000 of work for free out of that project. So that doesn't mean that we can do dental service for everybody. That doesn't mean that we provide dental services or that we can do it any time of year. It means that when we have a unique opportunity like this particular project, which we can run once a year, we would reach out to you and include you. Another example of it is we have begun this year the largest intervention on mental health that's ever been, I think, even thought of with this in a serious way with this population. We're working in 4 pilot states. We have a team member who is doing a serious evaluation of these folks who are willingly participating in this pilot project. We're identifying, screening them for serious mental health symptoms, and then we are getting them to treatment and checking back in to make sure it's working and finding out later what we need to do if it's not. In addition to using the healthcare that they have to do this, we've also secured some grant funds to pay practitioners to treat them directly. And we're very excited about this project. Too early to tell what the results are, but we're really making a run at trying to address one of the major long-term unaddressed problems of this population. So that's healthcare. So what I didn't say was that we're selling you anything, because we're not. We're also not treating you. We're not providing healthcare, but we are trying to be the advocate for you and the agent of change that gets you at a minimum to make use of what's available locally. And that's what we're very, very good at. So that's one area. The second area I said is legal services. And this goes back to what I was mentioning earlier. Harriet, if you need a lawyer for anything, call us up. Tell us what the problem is. And if we can identify a case for a lawyer to work on, we will find you a lawyer. If you remain low income, that lawyer will be free. We can't guarantee it, but we've got a better than 90% placement rate for these kinds of cases, be they family law matters or tax law matters or whatever it may be. And we will not just toss you a number. We will stay engaged, make sure that you show up for the lawyer and the lawyer shows up for you. And that has resulted in dozens and dozens of representations over the last 5 years that have gotten some very, very good results for the clients. And so that's the legal part. The third part is, I mentioned social service connections. We want to see Harriet taking it aware of and taking advantage of the social services in her community. And to do that, we will inform ourselves about what Harriet needs, find out what is available in the community, and try and get you to their door. Now, those aren't our services. That's not, we can't, sort of force them to be all they say they are. We hope they are, but we can certainly work hard to get the most out of what is available locally for you. And so that's the offering. And that is something that we can stand behind, have stood behind. We can make now to more than 800 people released after wrongful conviction across 48 states. I mean, a couple states we don't have anybody, and then people move, but we're basically nationwide coverage. And we do this, of course, entirely by phone, because the only way you can reach the exoneree population, if you're trying to really work with a lot of them, is by phone. So we don't fly around the country, and we don't have offices everywhere, because that would slow down the work, and also it would become a lot more expensive. So what we focus on is an entirely remote phone-based system. And one of the things I'm most proud of is, if I had told you I was going to do all of this 5 years ago before I started, I think you or any of your listeners would legitimately have said, you know what, how could you possibly get this done with all of this scam calling and all of this trust of what goes on and people trying to, take advantage of folks, how can you possibly expect to develop relationships with these folks and have this whole thing you just described work? And one of the things I'm proudest of is, well, I just did it. And now with my colleagues, we go out every day. We're on the phone with exonerees. We're talking with them. It isn't always as good as it might be. Sometimes we mess up, but the vast, vast majority of the times, we are able to build consistent, serious relationships that let us do great work for these clients. And they get it. Once we show them that we're going to show up for them and we're going to fight for them, every bit as hard as our colleagues in the Innocence organizations fight for their clients to get out, we fight for them after they're out. And so we have a vast, vast opportunity to add to this work and to do more of it and to expand the mental health initiative nationwide and to do more work in other areas. And I have no doubt we're going to do it because the results so far are frankly amazing and definitely worth deepening and spreading to others.
Wonderful. Sounds very, very comprehensive. Now we are a little bit short.
Yeah, we're on time, but I want to interrupt you. It really isn't comprehensive because comprehensive is one of the words that I'm very, very careful not to use.
Okay.
So and that's really important because it's very easy to fall into the idea that means we must do, as that other article you mentioned suggests, that we call people up and say, what's your greatest need? And then we go to do that. Let me tell you, many of the needs of this population remain unmet, including by our organization, because we have not yet found a way, for example, to do really effective and serious work on getting people jobs, right? Because that doesn't end with a few phone calls, and it's very tricky to stay on, and it takes a lot more time than we have the resource to do. So this is not comprehensive work, except to the extent that it's within the domains of healthcare enrollment and utilization. Sure, then that's comprehensive. And within legal services, to the extent that you can call for any kind of legal problem, yes. But when one of the things that's so difficult in the reentry world is that so many organizations promise to do vaguely so much. And very often you got a lot of clients out there who are left with so little. And so we try and under promise and over deliver in those particular areas rather than say that what we're doing is comprehensive.
Okay, I'm glad you straightened me out on that. All right, so as I started to say, we are short on time, but we would like you, John, to come back and tell us more about the things that you have done, and also possibly talk about individual cases, not necessarily mentioning names if you don't want to do that, but to tell us of your specific impact with people that you have helped over the 5 years that your project has been going on. And I just wanted to mention that the compensation issue, I'd like you to tell us a little bit more about that, because I think that's very important to straighten out people's misconception that some of these people get exonerees get a great deal of money, and they should be doing just fine with all that money, and that is not the case. So I'd like to pick up some of those thoughts next time when we meet again. So are you willing to come back for another interview with me?
Of course.
All right, wonderful. All right, so we're going to wrap things up for today, and we're going to pick up our theme of reentry next time. I hope our listeners have learned a great deal so far, and there's more to learn. So stay with us and come back and listen again next time on Pursuing Justice. And thank you, John, for being with us today.